Hi, it's Health Tidbits with Dr. Kohli. I'm Jenny D. And of course, you might see her on 9 News. She also does Cherry Creek Heart, accepting new patients. And wanted to talk a little bit. So if you didn't know, like I've been out for over a week. And it was one of those things. We've talked a little bit about advocacy and we've talked about gut health and things like that. All of that came to a head where with all the stomach bugs going around right now, there's a lot of them. Knowing when to be your own advocate and to push for care. Because when you go to the emergency room, they don't always, like, they're more meant to, like, stabilize you so someone else can do the other work.
Well, you know, it's interesting, Jenny. I think this has really evolved over time because when I was in training, part of what we did in the emergency room was not just make sure you're not about to die, but try to get a diagnosis for you so that you leave the hospital with some sense of what you have and where you're supposed to go. Now I've really seen a transition where a lot of patients of mine go to the emergency room. They say, okay, we ruled out this, this, and this. That'll kill you today, but now go follow up with your outpatient doctor.
Yeah.
And to me, that's a little bit of a unfortunately incomplete workup because part of why you're in the emergency room is to get an answer.
Yeah.
It's not just to know that you're not dying.
Yes.
You know, and for you, with your story that you shared with me, I was a little surprised that they didn't actually do some further testing because, yes, they figured out that there was no catastrophe going on in your belly, but it would have been nice to give you an answer.
And that was so I went to the emergency room. They, basically just gave me pain meds or whatever for the stomach issues and said, hey, go follow up in the next 5 days. Potassium was really low, so they gave me potassium. That was it. And so next day, didn't get better. If anything, got worse. And then went to urgent care and then did a teledoc visit, because I'm like, somebody tell me, this is not right. And it took the teledoc visit to be like, let's order some of this, just regular basic samples. Let's start at the beginning. Let's figure out what it is. Because if you've been sick for this long, it can't be good for you. And I was like, dehydrated, everything.
What I really like about what you did is you kept knocking on that door until somebody opened.
Yep.
And I think as a patient, you know your body the best. And if somebody doesn't give you an answer and you're having persistent symptoms, that's a red flag.
Yeah.
That clearly the underlying cause has not been identified.
And if I would have waited the 5 days, I would have been hospitalized. I could have C. diff, which is what they ended up finding. It's rare in the conditions. I don't know. I have any idea how I got it. But once they were able to treat it, then that's when it was like, okay, I get a little bit of relief knowing that at least I know what it is.
Yeah.
They know what it is. We can monitor the symptoms. We can do the antibiotics. But had I not done that, it would have been another 5 days of getting so sick, and I would have been in the emergency room. People have died from C. diff. It is really bad. And some of the advice I got from the urgent care was terrible. And if you do take any of the medicines that they asked, over the counters to take, I could have actually died right then.
It's interesting. In medical school, we're taught when you hear hoofbeats, you think horses, not zebras. But if it's not a horse, it's not just a GI bug.
Yeah.
The symptoms persist. You really need to start thinking zebras. And, C. diff, Clostridium difficile, is a bacterial overgrowth in your colon. Usually happens in chronically ill people who are nursing homes, people who've received recent antibiotics, where it wipes out your good gut flora and causes overgrowth essentially of this kind of bad bacteria called Clostridium difficile, which, as you said, can lead to something called toxic megacolon, which means your colon can shut down, it can rupture, it can make you sick, even to the point you get into the intensive care unit or die.
Yeah.
So the fact that you weren't getting better and the fact that they just kept sort of putting a Band-Aid on the symptoms, to me, worries me.
Yes.
Because there's so many people out there where this kind of a thing happens to. So I'm really glad that you advocated for yourself, and I'm glad you kept sort of seeking medical care until you got a diagnosis.
Well, and I think that's something that we don't really think of as much as our gut health and things like that. But there are things like learning about all of this, and I've been going down that rabbit hole just trying to make sure that I don't die. But, and I'm not even joking about that. It was pretty scary. But probiotics, prebiotics, what do you take? What is it? Something, especially when you're taking an antibiotic that's in a stomach that's already completely knocked out. There's got to be ways that you can keep building that good, like you said, that good bacteria as well.
Yeah, it's kind of ironic because it's a bacteria that is a result of too many antibiotics, and then you give an antibiotic to treat it.
Yeah.
But after that, as you said, you have to do damage control, really repopulate that good flora. In fact, one of the treatments for advanced C. diff, and I'm glad you don't have to do this, is something called a fecal transplant.
Ooh.
Where they actually take feces from another person
Oh,
that has
God, no.
a healthy gut flora.
Nightmare.
and they're tablets.
Yeah.
And so, but still, the point is
you still know what you're taking.
it's to repopulate the healthy bacteria in your gut.
Yeah.
But if you can do it I want you to start, having more yogurt. I want you to have cottage cheese. I want you to have natural sources of good probiotics.
Yes.
Not necessarily a huge fan of the prebiotics when you just had a C. diff type of infection. I like probiotics because they have active cultures,
Okay.
as opposed to prebiotics that need to sort of get activated to create that good bacteria.
Okay. And
But
that's
if
good
you're
to know.
eating a good, and so I really want you to focus on making sure you have good probiotics in your diet over the next several weeks until you're off the antibiotics. And it's probably going to be a prolonged course of antibiotics. But
Yeah.
the gut health is so important. We've started calling the gut actually the gut brain because it doesn't just affect our digestion, it affects our hormones, it affects our inflammation, it affects our blood clotting, it affects so many things in our body that we really need to start respecting it.
And it helps with so many other things. Like it helps with sleep. It helps with you don't know. It's kind of like a car. Like you don't know something's broken until you see the light. And when the light comes on, make sure, and I would just say this to anybody, like, and my parents and my brother are like, are you sure? Are you sure? And I'm like, something is definitely far beyond wrong. Like this isn't just a normal stomach bug. Like,
yeah.
And so be your own advocate and continue to advocate for yourself until you have some answers that you need.
Very true. And for you, you mentioned sleep. I really want you to focus on your sleep because when your gut health is off, it actually changes the way that you sleep. It changes not just the duration of sleep, but the architecture of your sleep as well, because the gut releases hormones, releases short chain fatty acids, that releases serotonin, which can help with sleep as well, tryptophan to serotonin. And it even changes the way our vagus nerve, which is kind of a rest and relaxation nerve, the way that works. So over the next few weeks, as you're healing from this, I want you to really pay attention to your sleep as well, in addition to what you're putting into your gut, just to make sure that that's not starting to become affected as well with everything.
So it might always, you'd hope to it would just be an upper GI or a lower GI thing and you'd be done. But if it's not getting better, then just make sure that you're reaching out. And find a doctor you can trust too. I learned that a lot over this last 10, 14 days. Find a doctor that you trust to actually listen to you. And so that's good. And Dr. Kohli happens to be accepting new patients. And I know for a fact that she's a great listener. So
thank you.
Take care of yourselves. I know it's that season, but I'm just really glad to be here with you guys today.